Well, good afternoon, and thank you for joining me here today. I'd like to acknowledge that we're gathered here today on the traditional territory of Treaty 6, and I want to acknowledge that the Métis people of Alberta also share a deep connection with this land. For well over a year, our opposition NDP caucus has been raising alarms about the chaos in Alberta healthcare, so much of which has come as a direct result of the policies and political fights that have been picked by the UCP government. We currently have hundreds of thousands of Albertans without family doctors, continued stories of prolonged wait for critical surgeries, a frequent and sudden closure of rural emergency rooms across the province due to staffing shortages, and the terrifying reality that now, when Albertans call for an ambulance, there is no guarantee it will arrive when they need it. This is a healthcare crisis, one that has been ignored by this government while it spends its time with petty infighting, the Premier's leadership review, and now a leadership race. While all of this has gone on, I submit to you that no one has been manning the wheel. Our healthcare system has spun out of control, and we have a lame duck government that is doing nothing to end the chaos. Sadly, I fear things will not get any better after the October UCP leadership vote. In fact, things may get far worse. We know full well that the frontrunner, Danielle Smith, has spoken in favor of privatization, of pay-as-you-go health care. But there's more. She's proposing wild and deeply irresponsible ideas that she apparently believes will overcome the chaos that so many of her new colleagues are in fact responsible for. And there's one that I want to reveal to you today and make sure that all Albertans know before the UCP holds their vote. On October 12th, Danielle Smith told a Facebook Live video the following, I quote, "It's something like 60% of the beds that are filled with people who are awaiting long-term placement, and I have to figure there's got to be a more comfortable place for them to go. I was thinking maybe a hotel would be a better environment." That's right. The potential next Premier of Alberta is openly musing about forcing ailing seniors to live in hotels while they wait for more suitable spaces in long-term care facilities. Long-term care beds require a registered nurse to be on hand 24 hours a day with all of the equipment and supplies that might be needed to assist someone with significant medical challenges. The idea that a purpose-built healthcare facility is interchangeable with a hotel is absurd. That's not a solution. Now, there's undoubtedly a need to move patients quickly to the correct level of care, and a big part of any strategy to do so will involve adding additional long-term care spaces and ensuring that transitioning patients occurs more quickly. But the answer is not to put those patients in the nearest hotel or motel, facilities that are not designed to deal with their critical medical needs. Hotel and motel staff are not healthcare workers. And there is no evidence that this horrendous idea would in fact save any money. In fact, I offer that it would likely cost more than simply taking the steps necessary to add more long-term care space, something that any reasonable government, any reasonable premier would make their priority. This idea, even simply as a concept, is ridiculous. And it's deeply troubling from someone who is running to lead this province, especially at a time when our healthcare system, thanks to the colleagues she wants to lead, is in such chaos. Now, of course, this does fit a troubling pattern of horrible healthcare developments since the UCP took office in 2019. First, earlier this year, we saw parking lot medicine emerge in places like Red Deer, where ambulances were lined up outside of that city's emergency room 15 deep, all with patients on board waiting for critical care. Then just a few weeks ago, we saw Edmonton hospitals forced to resort to hallway medicine as there were not enough staff and available rooms for patients, so several were left to receive medical care in hospital hallways. And now, rather than pledging real action to ensure parking lot and hallway medicine never happen again, we have Danielle Smith openly discussing a move to hotel and motel medicine. It's clear, when it comes to public health care, the UCP simply can't be trusted. Not the current Premier, and not the person who appears most likely to take over his job. The chaos in Alberta healthcare won't end with removing Jason Kenney. It's clear that instead we are destined for more incompetent leadership and more chaos in Alberta hospitals. So I am here today demanding that Danielle Smith and all of the other candidates for the UCP leadership go public and commit that they will never resort to hotel or motel medicine, because Albertans deserve far better than that. Thank you. I'm happy to take any questions.
All right, we'll now go to questions. If you have a question on the phone or the Zoom, please use *9 or the raise hand function. And Michelle, your line should be open.
Some of us listened to the full quote, and in fact, she sort of speculated about hotels, and then she went on to talk about how perhaps assisted living homes would actually maybe have spaces, because there's about, I think it was, she said something about 30% of them being open. So aren't you somewhat misrepresenting Danielle Smith's comments?
Well, to be fair, Michelle, she did initially muse about opening hotel and motel spaces before she began to speak about assisted care. And what we have seen from Ms. Smith has been a number of radical proposals regarding healthcare, and certainly, I think, deeply troubling approaches that she's interested in taking. Certainly some incredibly combative approaches, attacking the College of Physicians and Surgeons of Alberta and others. So I think this is of a piece. I certainly recognize that certainly assisted living facilities may be able to assist in some cases, as long as we ensure that the kind of medical support that folks need is available. And that certainly would not be the case in a hotel or motel room.
Do you have a follow-up, Michelle?
No, that's it. Thank you.
All right, Catherine, your line should be open.
Yeah, off topic, but I'm wondering if you have any thoughts on the government's announcement earlier today about the funding for more palliative care.
Well, thank you, Michelle. I certainly recognize the importance and the value of palliative care. I know for my family, when my father was in his last days with cancer that had spread from his prostate, we did have the support of home care nurses and others who allowed my father to pass away at home with all of us in our family. And that was certainly his choice, and it was wonderful that we had the support from the healthcare system to be able to do so. So I think all of us in the Alberta NDP caucus welcome any investments to try to help make that happen. What I will note is the investments we see today are investments to advance earlier access. We see some money to expand community supports and services, to improve healthcare provider and caregiver education and training, and for research and innovation. And in every one of those areas, this government has created additional chaos. They have made deep cuts. They have attacked the very healthcare providers. I remember hearing from palliative care physicians back in 2020, when then Minister Shandro, then the Minister of Health, the changes he was forcing through would have deeply impacted their ability to continue to provide palliative care, including in many rural communities. This is a government that has slashed hundreds of millions of dollars out of post-secondary institutions who provide the training and do the research and create the innovation that this government now claims it wants to support. So certainly I support the idea in principle and these investments that are being made, but there are far many more areas that this government needs to be acting on if they truly want to support Albertans in accessing palliative care.
Do you have a follow-up, Catherine?
Oh, no, that's all right. Thank you.
All right, we'll make another call for questions. If you're on the phone or the Zoom, please use the raise hand or *9 function. And see no more, that will conclude our press conference today. Thank you, everyone.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.